Hello, my name is Allison Werner, and I am the Chief Editor of Orthodontic Products. Welcome back to our new series, In the Sterilization Room with Jackie, where we talk with infection control and prevention expert Jackie Dorst about what you need to know as you prepare to reopen your orthodontic practice. For over 20 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She holds degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie and I both know that as you look ahead to the eventual reopening of your orthodontic practice, you are looking for the latest information and guidance on how to protect your team and patients when the doors reopen. So with that, we are back again to talk about what you need to know to minimize exposure to COVID-19 and what you need to know to establish best practices for your office going forward. Jackie, glad to be back with you.
Thank you, Allison. There sure have been a lot of changes since our sterilization room chat last week, with both the new ADA guidance that has come out with the president's announcement about reopening America, and how is that going to affect the orthodontic practices. So I think all of the orthodontists and their team members are now looking to their state dental boards and the state health departments for the announcement of when they might be permitted to go ahead and start scheduling those non-emergency patients. And with that comes the questions and the anxiety about, well, what PPE are we going to need now? What's going to be the proper infection prevention, disinfection with this airborne transmitted disease? And the ADA on last Friday published their new guidance with it, and it was emailed to all of the dental practices. Now, I would encourage, and you can see it's interim guidance, that's what's shadowed in the document. I printed out a version so that we would have it for our chat today. If the doctor received this as a member of the ADA, then please pass it on to the team members with it, because the office manager, the clinical manager, they need to have this 8-page document with it, because it lists a lot of detailed information about how we can safely treat patients in this post-closure reopening, and knowing that we do have more precautions to take with this airborne disease, and knowing that we're going to be seeing patients who are potentially infected. One of the concerns that is for the orthodontic team is that not all patients who are infected show signs or symptoms of the disease. And a patient may have been infected and not show those signs or symptoms for maybe 3 or 4 days. The average incubation is 2 to 7 days with it. So we might see that patient for an arch wire change or for delivering an aligner, and they're in the first stages of the disease, but they don't have a fever. They don't have the cough. And yes, that's one of the recommendations to when you have patients arriving, start coming back to your offices, that you take their temperature. But they may not be, and the data has shown, and as we've been going through with these with the disease and learning more about it, that there are some people who are infectious with the disease, not showing signs or symptoms, and are what are identified as super spreaders. That they are spreading more virus even than some of the patients who are showing signs and symptoms. So we're going to have to treat all patients as if they are potentially infected with the COVID-19 disease, and take those precautions. So it is a scary time. And I think the guidance that came out from the ADA, and then at the same time, the AAO looked at that guidance and interpreted it and put it out for all of the orthodontic members with it, and the AAO put together a wonderful web page that is opening up your office checklist. And in there are all of the items that the orthodontic office needs to consider, and the AAO is hosting daily webinars from their advisors, from the experts, on how the orthodontic team can implement these new recommendations. I did a webinar yesterday that was just on and I titled it Back to Work, Infection Prevention.
Mhm.
For the orthodontic team, what do you need to be doing that are the current recommendations that came out in the ADA guidance, and how does that apply to your orthodontic practice?
Okay. So what do orthodontists need to take away from this new guidance?
Well, I would first of all encourage both the doctor and the practice manager to look at it for employee safety, because on page 2 there were quite a few items to go through on employee safety, such as, has an employee already had a COVID-19 infection and have all the symptoms resolved? You know, they've gone past that estimated 14 days that they've been infectious. Now it's presumed that they would have an immunity to it. The scientist in the medical profession, we know that patients who've had an infection will have antibodies for it, but we don't know how long those antibodies are going to last, and if it will provide continued infection. And even you and I were talking before we started today's chat offline about the Los Angeles publication on, do we already have herd immunity? Are there enough people who've had a COVID-19 infection, one of the 80% that had mild symptoms, didn't know whether it was a cold or a virus, and now they have antibodies and they're protected? So let's be optimistic and hope that, yeah, we do have that herd protection, and that those antibodies are going to last, and it will prove that after you've had that mild infection that you do have acquired immunity to it. And that, as a microbiologist, that's been my hope going forward from when the first cases were identified in February and March with this disease. So I think looking at this, as I was reading through it, there's a lot of detail with the 8 pages, and I actually put together all of the list for, it says before, because the ADA divided it into before dental care starts, during dental care, and after dental care. It's a very organized document with valuable information. And as I was looking through it, it said dental health care providers, the DHCP, who are of older age, have pre-existing medically compromised conditions, or are pregnant, are perceived to be at a higher risk, and they should be considered for various work sites or job tasks with less exposure risk. So that's one of them. And then it went down to say that if we have a dental health care provider or an orthodontic health care provider, that if they've had an infection, that they could be considered as having that acquired immunity, and then they can in turn be on the first line. So if you have an orthodontic assistant maybe who has already had the infection, I would delegate the higher aerosol generating procedures in ortho to that assistant. You know, if you're doing a debond and you're going to be picking up a handpiece and there's more splattering or splashing, well, if Mary Sue has already resolved after having had an infection, then she would be the ideal assistant to have in that position where there's a higher risk, and have other team members maybe that are assigned to the chair where you're going to be delivering aligners. And there's less. So look at the procedures. And I belong to the AAO COVID-19 task force, looking at how this disease is affecting the orthodontic profession, and what guidance do we need? How can we help orthodontic offices? And then also looking to the regulations that are put out by CDC and the dental boards, and offering guidance to that will be beneficial to the orthodontic profession, let's say. And so a lot of this information is being considered in depth. And one of the things we've been asked to do is break down all of the orthodontic procedures into which ones are aerosol generating and which ones are not. And that's where this disease, that's really where the risk comes down to. Look at the aerosols that are generated by each orthodontic procedure and how we can protect ourselves with that N95 respirator, glasses. We know that diseases can be transmitted by just splatters or splashes to the mucous membrane, so you need to protect your eyes also. So that PPE is a line of defense. And then we're also going to have to look at the aerosols and the quality of air in the office. And we've talked about the quality of air in previous chats. So all of this is considered in this document along with the recommendations from the AAO.
Okay, great. So is there anything about this guidance that differs from kind of before closure infection control beyond just, you know, the fact that we're dealing with COVID-19? Is there anything that struck you as, wow, this is going to be a change?
Well, there's some things that struck me as they're going to be a change, but there were a lot of them that were identified in the webinar that I did yesterday for the AAO. And it's recorded and available to everybody. So it's getting back to work. You know, after the coronavirus, I'd encourage everybody to look at it. It's available to the entire team members now. And one of the popular questions that came up was our scrubs, because the ADA recommended that at the end of the day, that the clinical team removes their scrubs, leaves their shoes at the office, and changes into street clothes, if you will, to go home. And of course, then the questions came, well, how are our scrubs going to get cleaned? Yeah. Well, the first recommendation, and what is preferred by OSHA, is that they would be laundered at the office. Not all orthodontic offices have a washer and a dryer. So if you can't launder them at the office, then my recommendation was that your scrubs would go into a plastic bag and you could take them home and launder them at home. Ooh, and I'm going to see some people are going to go, what with this? But remember that you've worn that isolation gown whenever you're treating patients. And it's that isolation gown that is going to provide you protection from the aerosol splatters and splashes. And when they remove that isolation gown, then they're leaving the germs with it, and their scrubs are not going to be as contaminated. The ADA guidance further recommended that when employees go home, that they immediately shower. And I know as a hygienist in years past, when I was practicing, that would be one of the first things that I would do every day. When I got home, I went to take a shower, because at the time we were using a lot of blue mint flavored Nupro Profi paste. And as it would fly up her spreader, I would see little dots in my hair. I knew where the cross contamination was. It gave me a visual interpretation of it. So that was one of the first things that I would do. And so it makes sense to me, but it is going to be a change. I've heard many of the doctors and nurses that have been on the front line and caring for COVID-19 infection patients. And that's one of the first things they do. They go, I don't want to take this disease home to my family. Yeah. And they do change out of everything. And when they go home, the first thing they do is, again, to take that shower, leave all the contamination outside, not take it inside their home. And in some of the areas where they've had high rates of infection, first of all, New York City and Seattle, and now we're seeing this week, it's Boston and Chicago that are having the higher rates of infection. Then some of those nurses and doctors don't even want to go home. They've asked to stay in hotel rooms so that they're not at risk of taking the disease home. So we're learning more and more about the coronavirus, about the SARS-CoV-2 virus. But until we have more information and data, these are going to be the extra precautions. So the first 2 weeks of getting back to work and going back to practice, the orthodontic office needs to be planning right now for supplies. Estimate how many gowns, masks, shields that you are going to be using in that first 2 weeks. And you have to have adequate supplies to see the patients that you're going to treat. Right. And again, from the guidance in the ADA and from the AAO, we need to practice not just the 6 feet of social distancing, but even further distancing because of the aerosols that are going to be in the air. And one of my recommendations was, okay, if you have 6 chairs in the open bay area, maybe you schedule 1 chair at the very far end, and that's your chair that you do aerosol generating procedures, wherever you're picking up a handpiece. And then you don't schedule every chair, but every other chair. Right. And stretch those appointments out so that you don't have patients waiting in the reception room to come back. We need to immediately be able to seat them. So again, if you have a generous open bay area, you might be able to schedule possibly 3 patients, and maybe every 30 minutes to an hour, depending on how long the procedure is. But again, when we were talking yesterday for the scheduling management of it, my vision was to have a greeter greet the patient at the front door and then walk them back. And the doctor and the assistant are in full PPE at the chair, ready to treat the patient. As they finish treating the patient, then the greeter is there to take the patient back out. Hopefully they have another hallway that the patient can flow through with it. And then as the doctor and the assistant are ready to move to the next chair and treat a patient, and the sterilization tech comes in. And they're the ones that will be able to break down that chair, disinfect it, remove the instruments, take them into the sterilization room, and put them in for cleaning and sterilization. If the orthodontist and the assistant are able to move to another chair, and it's going to, with the same PPE on, that'll help to preserve PPE. That decision is going to be made on the procedure that they did.
Okay.
What was the volume of aerosols that were generated from that procedure? And I'm going to go to a debond because that's where we get the greatest splatters and splashes. Then they're going to need to sanitize their shield, replace the isolation gown. If it's something simple, such as doing again, an aligner delivery, maybe just changing an arch wire, you've got to use professional judgment about that gown and how often it's changed. In reality, the current recommendation is a new gown for every patient. But, the microbiologist in me looks at it and goes, well, if you're just doing an intraoral scan, do I really need a new gown in between each patient? So schedule patients so that they are physically distanced in the office. Schedule patients so that aerosol generating procedures are as confined and isolated as you can manage in your facility. And it may be that you even hang a shower curtain to provide a physical splash barrier if you don't have dividers in between your chairs. And I know the orthodontic office designers are all looking at what's the possibility of providing these dividers, or even just like a sneeze shield in between patient chairs. We get back to work.
Yeah, exactly. Well, let's talk a little bit about other issues that have been floating around this week. What are your thoughts on using UV light for disinfection?
I've seen a lot of that. And, in the AAO document, they included UV light as a possible disinfection. UV light has been used in hospitals for, I could say, 10 years. Through my APIC membership and watching the APIC message board from hospital infection preventionists, I've been watching how they use UV light as an adjunct for disinfecting a patient room where the patient has had a highly infectious disease, such as norovirus or Clostridium difficile, referred to as C. diff, that are just extremely infectious. UV light is an adjunct. It's not a total solution, Allison. We can't just assume that we can close the door to a room, put the UV light in there, turn the switch on, and leave it, and in 30 minutes, that's a sterile room. First of all, the room has to be thoroughly cleaned and disinfected before UV light is going to be effective. The light does kill microorganisms, and for that reason, you have to be cautious using it. In hospitals, they do close the door and nobody can go into the room for an hour or 2 hours, because if it shines on me, what's it going to do to my living cells? Or it could cause eye damage with it. So it has to be cautiously used, and the intensity of the light determines how long the light needs to be shined on a surface to achieve the microorganism kill with it. So the higher the intensity, the quicker the kill, but also the more precautions you need to have in with safely using. So I've heard of orthodontists who are looking at replacing the ceiling light in their open bay operatories with UV lights. And I'm not enough of a lighting engineer to know how safe that is going to be. It may be, again, an adjunct. And I know I talked with one of the doctors, and he said, well, we're planning on just, we'll close the bay at lunchtime, turn it on and use it at lunchtime, and then at night we'll use it. So that's an adjunct. It's not going to be the thorough disinfection. And remember, with light creates, shines on a surface, but what about where the shadowed areas are? If there's a shadowed area in the underneath side of maybe a bracket tray or even our delivery system, that's not going to be exposed to the UV light. And you're not possibly, it's not going to have a disinfecting effect on it. So there are limitations with UV light, but it is an adjunct that we could consider for our orthodontic practices.
Okay, great. Well, with some offices maybe reopening next week, what are your welcome back strategies for them and for the rest that will reopen in the future?
I think we need to put the fun back in it. Oh my gosh. Ortho, that's one of the reasons I love the profession of orthodontics for the 30 years that I've been in it, is that is positive, upbeat. It's a happy place to go to. The team members and the patients, yes, there's going to be anxiety in coming back. They're going to be anxious. They want to know, how safe is this? I mean, for almost 6 weeks, we've had infection control precautions and we've been isolated and sheltering in place. We go to the grocery store now and there's a shield up between us and the cashier. You have to go in one door and out the other door, and all sorts of changes that have happened rapidly. And our patients may not have that clinical training in infection prevention that the orthodontic team does. So we need to reassure them. And again, make it a happy place with it. When I closed the webinar yesterday for the AAO, I actually put up a photo of Wall Orthodontics team, and they had their balloons on the side, and this is pre-closure photo, of course. And then I was able to find a sign to put behind them that was a bright, colorful sign that said, "Welcome back. We've missed you." Gillespie and Wolford Orthodontics, they posted a Facebook page posting, I think on Sunday or Monday, and each one of their team members had written a sign and had a different word or a phrase on it, and they'd take their picture at their home in it, and it was from hope to smile to floss to, all of the different phrases, and there must have been 15 of them, and they made a collage out of it and pasted on Facebook and said, "We miss you. We miss seeing your smiling faces. We're looking forward to seeing you." I think that's the message we need to communicate. Hey, get some helium balloons. They are not going to transmit diseases. And put those up at the front and put a happy welcome back banner beside it so that we are putting in that, oh gosh, we're so glad to be back and we've really missed you as a patient. Because that's going to put the reassurance back into our patients as they come into our office. We're going to have some anxiety with it, but it doesn't mean we have to lose the happy.
Great. Well, I think this is great information for our viewers. Jackie, thank you for being with me again.
Oh, thank you, Allison. I am so grateful to Orthodontic Products for this in the sterilization room with Jackie time to chat and talk about the latest breaking information every week, because there is so much new information. It is like a tsunami. And sifting through it and deciphering what applies to our ortho office. Yes, this is an American Dental Association document, but how does it apply to us, to the care that we provide? So I'm delighted to have this opportunity, and thank you. You're a marvelous interviewer.
Thank you. Well, we will be back next week for the next episode of In the Sterilization Room with Jackie, as we help you get back to work. And if you have a question about infection control and prevention related to reopening the practice, leave it below in the comments section and we may answer it in a future episode. In the meantime, be sure to keep up with the latest orthodontic industry news by checking out orthodonticproductsonline.com. Until next time, take care and be safe.
Be safe, everybody. Thank you.
Thanks.